Okay.
Indeed, sir.
Let's
Long
move
term
on
sequelae.
to, yes, let us now move on to Dr. P. Monica. Okay, so the presentation is on advanced glaucoma in unilateral congenital ectropion, congenital ectropion UVA child with underlying neurofibromatosis 1. Okay. Dr. Naila, you'll be back at the end of the sequence of presenters, so please be ready.
Good evening everyone. Today I am here to discuss a rare case of advanced glaucoma with unilateral congenital ectropion UVA in a child with neurofibromatosis 1. Sorry, my slides are not moving. Can you reset it? The child presented to us with a complaint of drooping in the right eye upper lid since 10 months. On examination, he had a best corrected visual acuity of 460 in the right eye with an IOP of 28 mm Hg in the right eye. In the left eye, he had a normal vision and normal IOP. On anterior segment examination, the child had plexiform neurofibroma in right eye eyelids and there was inferior third corneal haze in the right eye cornea with peripheral anterior synechiae in the anterior chamber and leash nodules in the right eye and ectropion UVA with restricted extraocular movements. In left eye, there were leash nodules in the iris and rest of the findings were normal. Here is a pictographic representation of the findings. This is the plexiform neurofibroma in the right eye and there were congenital ectropion UVA and peripheral anterior synechiae in the right eye, and here I am showing you the leash nodules in the left eye. On gonioscopic examination, the child had anterior insertion of iris with angle dysgenesis in the right eye with broad-based peripheral anterior synechiae, and the left eye angle structures were open and there were irregular patches of pigmentation around the angles. Posterior segment evaluation showed a CDR ratio of 0.9 in the right eye with diffuse RNFL thinning. Left eye cup disc ratio was normal. On systemic evaluation, the child had Café-Ole spots. On imaging, MRI showed optic nerve plexiform neurofibroma on the right side and temporal lobe herniation and sphenoid dysplasia. So after seeing all the findings, what could be the diagnosis? And here is the correlation of findings. Advanced glaucoma, Café-Ole spots, optic nerve plexiform neurofibroma and angle dysgenesis, pointing out our diagnosis towards neurofibromatosis 1. How did we manage this child? Initially, the child was given medical management with dorzolamide 2% and timolol 0.5% twice daily in right eye. Subsequently, the child underwent right eye orbital debulking and 6 months later, a non-walled glaucoma drainage device with a tube insertion in anterior chamber was done. This child was followed up after 1 year and the right eye best corrected visual acuity was 460 and IOP was 16 mm of Hg, which was within normal limits. So coming to the discussion, so glaucoma is a rare complication in neurofibromatosis 1. It is 23 to 50% in orbitofacial involvement and ipsilateral lid plexiform neurofibroma. And the various pathogenesis include developmental angle anomalies, neurofibromatous infiltration of anterior chamber angles, ciliary body, choroid and anterior synechiae. And the various management options available are glaucoma filtration surgery and drainage device placement. So what is the take-home message from this case? In our case, a comprehensive glaucoma evaluation, which was supplemented with imaging and surgery, played a crucial role. So in cases of childhood glaucoma, a stepwise thorough glaucoma evaluation and timely wise management can prevent blindness. These are my references. Thank you.
So I have a comment to make. Whenever you're presenting, say, a case or a case series, you have to compare and contrast it with other cases or other related documents which have been published in peer-reviewed literature.
Okay.
So is there something that is already published and you can associate your findings like
Sir,
X,
I
Y, Z?
saw one publication which was done, sir. It
Yeah,
is in,
XYZ found a case of this with these findings.
it
And
has a
observed
similar, like that article also has described a similar presentation, sir, but the age group was little different.
Yes, so this is the discussion that we were expecting in the slide. Okay.
Okay, sir.
So we are not here for a class on neurofibromatosis, but we are here for research. We are here for understanding the clinical implications of your findings.
Okay,
Okay.
sir.
So
Yeah, so how common is peripheral anterior synechia in neurofibromatosis?
Ma'am, it is mentioned in the, according to the articles, a review of literature, it is mentioned if there is orbitofacial involvement, then the incidence is given like 23 to 50%, ma'am.
And what is the cause of this synechia?
It can be due to the neurofibromatous infiltration in the angle structures.
Because normally what is the type of glaucoma you see in neurofibromatosis?
Ma'am, it's a congenital glaucoma which is secondary to this neurofibromatous infiltration.
Okay. It's an open angle glaucoma, isn't it? You get an open angle glaucoma. Okay, thank you. Anything else?
that is to say that the dysgenesis is basically a histological term, and dysmorphism is what you see on the gonioscopy.
Okay, sir.
Okay. Right. So thank you very much.